Okay, so if we want to talk game changers, we're going to talk about the glutes, back pain, flank pain, and most importantly, the sciatic pain that most people come in and present with and assume it is entirely coming from their back isn't always the case, and a lot of change can be made by understanding how to properly treat these muscles. Best tool is a lacrosse ball. Tennis ball is more friendly, if we're being honest, but a lacrosse ball is going to get the deepest. These are big muscles and do need some deep tissue work. You're going to isolate the pain, typically going to be on the side of the hip, but you might also be able to kind of go back to a quarter turn and look at getting to the muscles through a kind of a quarter turn in the back half of the glute there. You're going to move around on the ball and try to identify the spot that causes pain. It should reproduce a pain that you are familiar with. A pain that shoots down the leg. It may make something shoot down all the way to the toes. You might get some numbness. You might get some tingling. You might get some referral up into your back. The key is identifying a pain that you feel you have felt before. You can expose lots of different areas of the muscle by just simply modifying your body position, changing the location of the ball, isolating the spots that are replicating your pain. And then the big key is as soon as you identify the spot that finds the pain, don't roll around, don't move, don't knead, don't massage. You are holding that position and just trying to relax. Your body's going to fight it. Your body's going to want to levitate. Give it 30 seconds. It'll start to slowly settle like a bird over an egg. The muscle will slowly relax. What's happening? The blood is not getting to the muscle because you're blocking it with the pressure of the ball. The contraction, which needs the oxygen and blood to stay tight and spasming, will start to slowly release, and with that will go most, if not a large chunk, of your low back pain and sciatica symptoms that you've associated with your spine all this time. If you don't have access to a lacrosse ball, the foam roll is still a viable tool. A little more uncomfortable to get yourself in position, so I don't often use the foam roll either on myself or when I recommend it to other clients, but still getting on your side and getting over the foam roll and identifying some spots can be an effective tool if you happen to have one and don't have the lacrosse ball. Lacrosse ball will just be able to localize a lot better and get a lot deeper. And again, if you're not ready for the lacrosse ball yet, the pressure is too deep, the pressure is too much, just try a tennis ball to start, get yourself used to it, and allow yourself to work through that before you progress to the lacrosse ball.